afternoon, everyone. It is 2:30. Welcome to CCDPH COVID Schools Update. My name is Kelly Jones. I am a health educator senior in our Community Engagement and Health Education Unit, and I am your moderator and facilitator for our calls. Let's get started. It's good to see everyone. There aren't much updates that I can give as far as announcements, but I still want to make sure that everyone gets the information in case they need it. Our objectives, as usual, are to support our schools while navigating COVID-19 and answer any frequently asked questions that you may have and provide CCDPH contact information and resources. A few announcements. As you all know, we've already gone to a bi-weekly format. We are assessing how much longer we're going to continue this bi-weekly format and adjourn for the summer. So be on the lookout. I'll give updates when we come to a conclusion, but we are discussing when we're going to end our format as the rates are going down and there's less updates to give. So we'll make sure we give you that information when it's available. Our webinars are all recorded and they're uploaded to CCDPH's website as well as our YouTube page if you need to go back and reference any of our recordings afterwards. We start at 2:30. Please keep your line muted. I normally disable the chat, but we have two people who are coming on to present as well as our CD update. So I thought it'd be easier to just leave the chat open in case you have questions for our presenters. And please make sure that you confirm your email address, as I get a lot of emails bounce back and returned undeliverable when I send out the presentation. We want to make sure that everyone is able to get this information. Here is CCDPH contact information if you need it. Our general email address is the ccdph.covid19 and cookcountyhhs.org. You can send your webinar related questions or general questions. Our communicable disease, I'm so sorry, spam gets you every time, don't they? Our communicable disease email address, if you have any questions, you can report line lists and metrics questions as well. Our CCDPH website and our school specific website, as well as any other tools and downloadable information, is available for you to use. If your school would like to participate in the EpiPen request program, please send all requests to myself, kjones1 at cookcountyhhs.org. The request must come from a medical professional or have been trained in the administration of medication, and please type all your requests. As you know, you can request at-home COVID tests. You can just go to covidtest.gov and request those COVID tests. There's no limit on when you can request those tests. Alternatively, you can go to your nearest pharmacy and you can pick up a test and have them run your prescription or be reimbursed by your prescription at the pharmacy if you need it immediately. For those of you who are unaware, the Health Resources and Service Administration was the entity that was funding the free COVID testing and vaccination for uninsured and underinsured individuals. That funding has ended. CCDPH is working on giving you the most updated information on that, and we're concerned in how this will affect people who are uninsured or underinsured. Alternatively, you can still go to Cook County Health Department's health clinics or any federally qualified health center, as they are not affected by those changes. Here is a list of our Cook County Health Department clinics if you'd like to go to this clinic or refer anyone in your community to this clinic. And here's just some updated Cook County Health Department sponsored vaccination events that we have going on today in the Dalton West School District. And it's in very small print, hard to read, but you can also be eligible for a $100 gift card for participating in this vaccination event that's going on today until 5. Here's a list of other events that we have going on throughout the community. This is just a snippet. If you go on to the Cook County Health Department calendar, you can see the other events that we have sponsored and co-sponsoring throughout the community. If you have any concerns about testing sites, if you think that there's any criminal activity or anything like that or fraud going on, please report it to the Attorney General's office. The phone number is below. I will attach the flyer for this upcoming training, but there is an upcoming school-based mental health roundtable event happening Tuesday, April 19th, sponsored by River Edge Hospital. As you know, you can participate in the rapid antigen Binax testing kit sponsored by Cook County Health Department. You can just fill out the information that's on the website attached. If you would like information on shield testing, you can email the IDPH team and get that started for your shield testing for your school. If you'd like to have a school-based clinic at your school, you can request it with the following email addresses at below. There's Crystal Winston, Ursula Harris, or Victor Martin are the people that you can reach out to. And it's just some information on how to host that clinic and tips and tricks. Other educational information, as well as information on how you can request a speaker for your organization or event. And as usual, you can still request the free rides to your vaccination appointment using destination vaccination, as well as your home-based vaccination for any homebound person, as well as those people who live within the home. And that is still covered under the funding for Cook County Health Department at no charge. Thank you so much. I will now introduce Amy O'Rourke, who is the Director of Chronic Disease and Prevention and Control for Cook County Health Department. She is going to speak to us about a program that they have, and I'm going to stop sharing, and I am going to start Amy's slides.
Thanks so much, Kelly, and hello, everyone. Thanks so much for having me. Again, as Kelly highlighted, I'm here today to talk about the Cook County School Health and Wellness Survey. CCDPH, the health department, worked with the intermediate service centers to distribute the Cook County School Health and Wellness Survey to all suburban Cook County K-12 school districts over the past week. You may have received an email late last week or early this week, depending on the district you're in. This email did include a survey link, and this was sent from the intermediate service centers to superintendents across the region. Thank you to those that have already completed the survey. This online survey is to be completed by school district administrators on Microsoft Forms. And today I'll provide just a brief overview of the survey, what we're hoping to collect, a little bit more about the purpose, the survey instructions, and the submission deadline. If you are not familiar with this, I would encourage you to contact your school district superintendent to ensure the survey was completed on behalf of the school district. And if you do have any questions about the survey, I'll share the email address you can send inquiries to at the end of my brief overview. So just a little bit of background regarding the purpose of this survey. And Kelly, you can advance to the next slide. Thank you. So Cook County Department of Public Health is working with the Illinois Public Health Institute and our partners and colleagues at the Illinois Alliance to Prevent Obesity. We're interested in learning how suburban Cook County K-12 school districts are meeting state health and wellness standards and any potential barriers to implementation and potential resource needs. We recognize that there may be some gaps or challenges with implementing these state standards, especially, considering COVID-19 and how that may have impacted, for instance, your ability to support PE or offer recess. So we would love to hear from you regarding your experiences with implementation and help us identify any implementation gaps and challenges so we can collectively inform our future actions, whether that's policy change, technical assistance that school districts may need or need to support with the implementation of these policies and mandates, and if there is a need for resource development or access to funding, for instance. All information collected from this survey will be kept confidential and just used for our internal program planning. So again, this is a voluntary survey. We encourage all to participate to help inform our collective future actions. And you can advance to the next slide. The survey asks questions around health and wellness services and programs offered throughout the school district, behavioral health services and programs throughout the school district, nutrition and school meal programs offered throughout the district, physical education programming, chronic disease management, including maintenance of stock emergency medications. You can advance to the next slide. The survey is intended to be completed by someone familiar with the school district's health and wellness services programs, behavioral health services and programs, nutrition school meals programs, and physical education programming. Only one person per school district should be completing the survey on behalf of all schools within the district. We anticipate that the survey is approximately 15 to 25 minutes to complete. And we will be collecting surveys from school districts through Monday, April 25th. If you do have any questions, you can contact us at healthycook@cookcountyhhs.org. So if you are completing the survey on behalf of your school district and you have questions about survey questions, again, you can contact us. It's important to note on Microsoft Forms how we've designed this survey. And once you're in the form, you cannot save, unfortunately, and come back to the survey. You do need to complete the survey all in one sitting. If you do provide your contact information at the end of the survey, which is optional, we will be planning to follow up with those that provided their contact information to further discuss your resource needs, development, and technical assistance options based on your answers. So we look to follow up with you following the close of the application, or excuse me, the survey, which would be April 25th. And I think that's all the information I have for you today. We really encourage school districts to participate, and we really appreciate your support in ensuring your school district does complete the survey to provide some helpful information into what we do from here on out to offer supports to schools with implementing your school and health wellness policies and procedures. I see a question in the chat. Who did you say this went to? Yes, this did go through the intermediate service centers. They sent emails to all the superintendents within their region. These emails were sent either late last week for the South region and West region intermediate service centers, and earlier this week from the North region, or to the North region superintendents. Any other questions? Great. Well, we appreciate your support. And if you do have any questions, we do have the contact information for Healthy Cook at Cook County HHS. Submit your questions and we'll follow up. We really appreciate your partnership in this. Thank you.
Thank you, Amy, for taking the time out to explain that program. Are there any other questions for Amy that we can answer right now? Okay, I don't see anything. I will make sure that I attach these slides to our handouts when we send everything out later on. Again, Amy, thank you so much for taking the time out of your day to explain that to our school community. We appreciate you.
Thank you again. Appreciate your partnership. Thanks. Bye-bye.
Thank you. I'd like to reintroduce a familiar face, Dr. Rachel Rubin, who is our Chief Medical Officer and co-lead for Cook County Health Department. She is going to come on to answer a few questions and help quell some of the confusion that we have had at our last meeting. Welcome, Dr. Rubin. Thank you for taking the time out of your day to come on.
Yeah, thank you so much for having me. I always like meeting with this group. You guys are tremendous. So I'm just going to say a few things. I don't have any slides, and then I will try to entertain as many questions as we can over a few minutes. Basically, there was concern about whether schools that felt it was important to do so could put in place their own masking protocols. And that there had been some pushback that some schools had received, or they had heard information that certain legal lawyers had said that it was not possible, considering that the state had lifted the mandate, that it would not be possible to put in place a masking mandate or masking rules within that school or school district. And I'm not a lawyer, so I'm not going to respond to that on the basis of a legal question per se, though I did run this by the legal counsel of who we work with Cook County Health. And their opinion was that a local school district is allowed to make their own rules as long as it's not less stringent than what the state rules might be in place, such as what ISB or IDPH have put in place regarding to COVID or any communicable disease for that matter. And I tend to agree with that, at least on the basis that if, for example, you have a classroom where two best buddies turn positive for COVID, and they're part of a, and it's a close-knit classroom physically as well as sort of emotionally, friendship-wise. And so the school decides that maybe it's a good idea that either to quarantine the whole classroom or part of the classroom, or if not quarantining, at least saying that the kids in this classroom, if they're asymptomatic, have to wear masks for 10 days. If they're symptomatic, then they're out and they get tested and they go through that protocol. And the protocols are now, even though they're not mandated, the protocols now is that indeed, if you do test positive, you have to be home for a minimum of 5 days, and you have to wear a mask for the second 5 days, days 6 through 10, after you've tested positive or after your symptoms have started. And so these are the kinds of rules that can be put in place by school districts, and I think are prudent to do so. And in fact, the whole Test to Stay program, which allows students that have been exposed that have not been vaccinated, we're talking about pretty much unvaccinated folks, younger children, meaning then, is that what it says now for Test to Stay is that you can even stay in school if you are a close contact, provided that you're tested, immediately, and then on day 3, 5, 7, whatever what's specified by the CDC, and you wear a mask during that period of time. You wear a mask for a full 10 days, but you can stay in school. So I think that the way we keep our kids in school safe and we stop the spread, especially if there is the evidence of maybe a small little mini outbreak in a classroom, is that for a school to have in place a policy, and that's required if you even do the Test to Stay option as part of it, is that you have to have a written policy. And I think that this would be a very important thing for all schools and school districts. If it's done by the school district and it applies to all the schools in that district, then that's great. And do it that way, to have a protocol in place for exactly these kinds of situations. And if there's a small school or whatever that decides that they want all the children to be masked for now, until we're sure we are really beyond needing it for COVID, then I think that that's totally appropriate. And this is something that is allowed as an individual choice. And it's not only individual choice in terms of me as an individual person or for my child, but also for the school as an individual school or an individual school district. I think it's totally appropriate to have these kinds of protocols in place. And these protocols include all of the things that staged kind of process that we use to keep our schools safe, which includes improving and maximizing the ventilation systems, the physical distancing as possible, the masking, and of course, vaccination and cleanliness, washing your hands. So these are all things that sort of need to be done together, and maybe not everything has to be done at the same time. So masking is the easiest thing to sort of lift on and off. But right now, we're seeing a slight creep up in the BA2 variant or subvariant of Omicron, and we're not seeing increased hospitalizations or ICU admissions, which is wonderful. In fact, those are still inching down a little. But as this BA2 variant increases and as people begin to possibly get infected with it, the lag in hospitalizations and the lag in ICU admissions happen several weeks later. And so the idea is to stop that kind of thing now. And one of the things that helps doing that is masking. And the most important thing, of course, is vaccination. And to get folks vaccinated, all children 5 years old and older can be vaccinated. So please go ahead and do that. But aside from that, I think the masking question should be left up to the school districts at this point. And we at this point are not contemplating putting masking back in place as a mandate. But if we begin to see a surge of the BA2, that might be something that the state and CDC and then ultimately the local health departments will consider. So I'll leave it at that, Kelly.
Thank you, Dr. Rubin. Are there any questions for Dr. Rubin? While we are waiting on the chat, I had a private message that asked, is there a Dr. Rubin fan club? Because they absolutely adore you. So I thought that'd make your day.
Thank you. That's so sweet.
Last chance for any questions for Dr. Rubin. For the slow typers, you may also unmute yourself if it is a pretty long question to type. That'll give you a chance to ask your question live and in person. This is a quiet group. You guys had a lot of questions last time. It always works like that. It's like when you go to the doctor and then whatever hurts stops hurting. So we had a lot of questions last time, and this time we don't.
Well, maybe I made everybody feel good. I don't know.
I hope so. That's a better way of framing it. Dr. Rubin answered all the questions, and we got some thank yous in the chat. So what we'll do is, if there are any other questions, you guys have the email address that you may email to get your questions answered. And we appreciate Dr. Rubin taking the time out of her busy schedule to clear up any confusion. And we'll try to continue to answer any of those questions as they arise. Thank you, Dr. Rubin. Have a great afternoon. And Lex, you have the floor.
All right, so we just have kind of some updates on guidance, which is it's definitely different, but it's kind of a more simplified version of what we've all been doing. We're kind of moving towards like a individual responsibility model where people are a little bit more responsible for just taking care of themselves and reporting on themselves as we're getting into this era of slightly lower transmission, knock on wood. So that, metrics updates, and then just a little bit about unique situations that I want to go over. You guys know the drill about what our priority is. And just as a reminder, remember that infectious disease reporting is the law. School personnel are mandated reporters. Please continue to send us line lists when you have updates. And if you haven't had cases in a while, we've had some schools with some pretty good streaks lately. We'll try to follow up with you if we haven't heard in a while. But if you are on one of those good streaks and you just want to let us know, hey, we haven't had a case in so many days, that would also be super helpful. And of course, we're seeing, flu is slightly increasing, so we've got that going on. That's not reportable unless it's really, really bad for kids. But there have been some scabies, there's chicken pox, so all those things, of course, should also be coming to us. All right, and then just as just an FYI, if you didn't get an email about this from the state, on the 30th, they updated school guidance to make kind of a one-stop shop document that's basically everything we're about to discuss, what to do if you get an outbreak scenario in school, which is a lot less likely now, but will still happen from time to time. And then, of course, the usual really helpful flow charts that go through different scenarios. In terms of data, this is where we are right now. We're kind of plateauing-ish, but as Dr. Rubin mentioned, we're seeing a little bit more of BA2. So we're hoping we stay at this lower level. But of course, we'll let you know if our transmission does get higher. We're still in low transmission, which is great. We're slightly higher than when we met 2 weeks ago, but not by too much. And the number of school outbreaks that are active at the moment has absolutely dropped, which is fantastic. Although Cook does make up the of just about 2/3 of the school outbreaks, but we're such a big county. So that's really fantastic news. So many fewer outbreaks. And then if you hadn't checked Chicago's travel website or CCDPH's travel website in a while, we are now looking at this county map from CDC that breaks down the community risk level in the individual counties. So it goes low, medium, and high, as you can see from this map. Pretty much what you need to be concerned about for spring break, like For example, my mom is on sabbatical at the moment and she's going to Traverse City. Well, Traverse City is one of the only places in the Midwest that's in high transmission right now. So, what should you do based on the different transmission levels where you're going? If you're going to a low risk place, regardless of your vaccination status, pretty much all you have to do is monitor your symptoms after you return from travel. Make sure you're feeling okay when you go back to work or back to school. If you're in a medium risk area, think of your own health and the people you come into contact with and consider masking indoors. But if you are going to a high risk area, you should be masking indoors if that's not a mandatory thing to be doing in those places to begin with. Shouldn't be going there to the best of your ability if you're not up to date on your vaccinations. But if you're not vaccinated, the best thing to do is have a 5-day travel quarantine and then test a couple days after you return. But in terms of schools, for the most part, students and school personnel can return immediately. It's still recommended that they get tested, but schools are allowed to enforce that travel quarantine if they would like, or enforce more stringent travel policies if you've noticed that spring break is a little bit risky for your school. All right, for international travel, it's pretty much the same. If you're flying, you've got these testing requirements regardless of your vaccination status. That hasn't changed, but the CDC removed the cruise COVID advisory, so that's great. But again, as we're moving to this individual responsibility model for the pandemic, always be analyzing your own risk level. If you do decide to go on a cruise, and encourage your students to be, well, they're children usually, but encourage families to, take into consideration that cruises can be a little bit germy. So make sure they're healthy and okay to go. All right, you do not have to worry about trying to read the new decision tree. I just put it up there for reference, but the link is on the page and you can also just Google it. It's like the first or second thing that comes up. But here are the highlights from the updated decision tree that we have all been very patiently waiting for. So the first thing I want to say is that symptomatic individuals who are not known close contacts can return with a negative home test. That has to be documented, so you have to have a picture or a screenshot of those results. As long as they're fever-free and diarrhea-free without the aid of medication, as per usual, and as long as their symptoms are improving. If they've got a really terrible cough that's going to make them miserable at school, they should wait to go in. But for people who aren't close contacts that have some symptoms, especially I've got a runny nose as we get into allergy season, home tests are going to be a great resource. So that's a new thing that's really going to make our lives a lot easier. And then second thing is a symptomatic close contact can return if they get a negative lab-based PCR or 2 or more antigen tests spaced 24 hours apart. So in this situation, you are allowing someone to test out of quarantine, essentially, in addition to having, of course, test to stay options. So that's the new highlight. Next thing, this has been what we're doing, but kind of puts this very clearly in writing. Proper isolation and quarantine is 5 at home and 5 at school with masking, or 10 at home without masking if they're unable to or unwilling to mask in school. That's the definition of how that needs to be quarantined. That is in the administrative code. So that is what proper isolation and quarantine is. That is what schools should be doing when they've got a close contact or a case. So that's also in the decision tree. Next highlight is that symptomatic individuals who return after 5 days without a negative test, so let's say they just never got tested, but they've had a headache for a couple days, they should be masking for the next 5 days, since we don't know whether or not they were truly a case. So if you've got a symptomatic individual who can't or won't test, they should be masking for the next 5 days after they return. That's something we've been doing, but it's in writing. And then lastly, test to stay requires 2 tests over the 5 to 7 days and extracurricular exposures are now eligible. Hold on, let me let someone in from the lobby there. Okay, so extracurricular exposures are now eligible. We're talking like sports, extra clubs, and things like that, not necessarily a workplace exposure if you've got a student with a part-time job working at like Jamba Juice or something. So, sports exposures, after school band stuff, all good for test to stay. All right. And then just to go back to home tests, you guys can decide if you will accept home tests, or if you'd like to verify home test results, or be more stringent. The base guidelines is that you can accept negative home test results in certain circumstances, but you can always ask for verification. As Dr. Rubin said, you can always go more stringent than our baseline level. So I just wanted to say that about home tests, and then please be reporting home tests, because they're not automatically sent to us through a lab system or a doctor's office, and so the only way that CCDPH knows about a home test result is through that person sending that documentation to the school and the school reporting it to us. So it's really important for you guys to make sure families are documenting that and then sending that over to us when you've got a positive, especially because that 90-day window will allow people to stay in school. So as long as we have documentation of that positive, you know, they aren't necessarily a close contact. All right. The sports guidance was updated for the first time in several months, but basically, universal indoor masking for sports is no longer required, except if you're in like a facility that requires masking, or there are specific rules that require masking. So not required, and especially as we're getting into the nicer weather, it won't be as much of an issue anyway. Most of the sports will be outdoors. But close contacts who are within their 10 days of quarantine do have to wear a mask to participate. If they're unable to wear a mask, like they're wrestlers or something, so it would be unsafe for them to be wearing a mask, they have to find other ways to participate, you know, doing training, conditioning, or if it's basketball, shooting hoops a little bit further away from the other players, that wouldn't put them within 6 feet of others. And the same goes for cases, and everybody in these situations needs to be asymptomatic. So close contacts can return to play if they mask, which is great, but that masking has to be, you know, that has to be good and correct masking. That can't be sprinting and constantly pulling up your mask. That's going to spread germs. All right, and then I think this is the last thing I wanted to add. For unique situations, and by that I mean situations where you have a student who can't mask due to medical reasons, some kind of disability, after they've had close contact or positive test results, we want to get those kids back to school as quickly as possible, as long as it's safe. A lot of times those are students who really benefit from in-person learning, as you guys know better than we do. So if you've got a unique situation like that, we would love to try to work with you to determine if an early return is possible. Since they can't mask, normally we would say, well, that's the full 10-day quarantine at home. But you know, based on the risk of severe disease of others in the classroom, based on other people's masking abilities, vaccination status of kids in the class, how distant you can be in the class, it may be okay for them to return after the 5 days. So we would love to work with you on an individual basis for these situations so that we can get kids back in school sooner. Just let us know and we'll try to work with what you have to see what is a safe option. All right, yeah, and we didn't have any submitted questions, so that's it for me. Let me stop sharing and I'll start taking questions.
Jenna and I did a test because the chat is eerily quiet, so we wanted to make sure it wasn't broken like it was again a couple of months ago. So, if you have any questions, feel free to put them in the chat. It looks like the chat is working according to our test, so we just want to make sure. Maybe you guys are just enjoying all the information and you don't have any questions for us. So, we will give it a few minutes. If you're unable to chat, you can unmute yourself and ask any questions you may have. No questions. Wow, this is a record. If is there anything else that you would like to put out to the group, Lex, before I wrap up?
Just, when you have those unique situations or you have any questions about what we've just gone over, especially since things are still continuously changing, even though we're in a much safer environment than we were in recently, um, always send those questions over to CCDPH and we'll try to get back to you within 48 hours at the most. Oh, looks like we had one question. Are we still waiting to test symptomatic students in school? No, you can go ahead and test symptomatic students in school as long as they haven't had any kind of documented close contact. So if you've got leftover Binax Now tests or new Binax Now tests or other rapid tests, that's totally fine. Do you know of any free local testing sites now that the IDPH testing locations closed yesterday? I don't know off the top of my head, but I do know that the White House recently launched covid.gov, and you guys know what that is, but I'll put it in the chat anyway. And that's supposed to be like a one-stop shop of testing resources, get tests shipped and things like that. So check out that as a good resource. I've heard that it's up and running just fine. So try to check that out. And again, as we're going into this more individual responsibility model, get those home tests. Encourage families to get those home tests. I think if you haven't noticed, I'm in a new place. We ordered the home tests from the federal government at our old house and our new house. So, always a good thing to have on hand. All right. Are there any guidelines for?
I
Oh,
just
sorry.
want to jump in. I'm sorry. You can just want to jump in for Andrea's question. You can also go to Cook County Health Department's clinics. The list is in the slide deck that will be shared, as well as any federally qualified health center, as they are still being funded for those testing and vaccination, and that they aren't affected by the change in the HRSA funding.
Thanks so much, Kelly.
No problem.
Are there any guidelines for disposal of expired Binax Now tests? As long as they're unused, you can throw them out like any other garbage that you have. If they are used, obviously that would be biohazard waste and that has to go and be incinerated. But unused, totally fine to just toss it out.
Lauren says the ones on spring break must have been the ones that asked all the questions. So could be, could be. You never know. Are there any more questions for Lex? Alrighty. Well, I want to thank Dr. Rubin. Oh, we have another question coming in.
Since many students are no longer masking in classrooms, are we able to eat lunch closer than 6 feet? In general, yeah, that's totally fine. But if you have someone returning after 5 days who's still in their 10-day quarantine or isolation window, they should try to be spaced out 6 feet from others still. So you might want to have a designated area where they can still eat with their friends, or just, have default larger spaces to the greatest extent you're able to accommodate.
That's a great question. Well, I want to thank Dr. Rubin and Amy O'Rourke, who took the time out of their schedules to present to us. Thanks to Lex and Michelle for keeping us updated. And thank you all for your support and for attending our bi-weekly meetings. We will see you at our next meeting on April 15th. Thank you, and hopefully spring will come. It's a little chilly outside, but hopefully we'll get some warm weather, and we will see you all soon. Thank you.